Hi guys, it's Dr. Selene with BU Medical. I want to talk to you about a laser that I really like if used correctly, and it's called the Vivace laser. It's our microneedling with radiofrequency. I see a lot of people do microneedling, but without the radiofrequency, and I really feel like it's the combo of the two that really gives you the results. So microneedling alone, I liken to just aerating grass. Microneedling with radiofrequency, however, gives you increased collagen, elastin, regeneration. And it's not one size fits all. I've noticed a lot of medical spas just promote this machine just for acne scars, and it's their one-stop shop, and it's not like that. So this is one modality in the various modalities we have within the laser world that is helpful for acne scars. It does take a series of treatments. It also helps with tone, texture, some pigment as well. But remember, we want to combo this modality with the other modalities that we have. Kristen, my model here, has done IPL. I want her to do CO2, and we're comboing it with Vivace microneedling. So it's not a one-stop shop ever. If you get sold just on Vivace alone, it's probably not going to be enough. We want you to do this in a series. You're not going to see the results for a few weeks, so just be patient in the process. Remember, collagen and elastin take time to rebuild. Remember that throwing different things at your skin is important. So this is one of our tools in our toolbox. It's not the only one. If you think that you have acne scars and they're going to be completely eliminated with this modality, you're wrong. So don't think that this is the only thing that you can do. The other thing that I also say is we have to put something on top of the skin. So when you see things that are kind of eccentric, like Kim Kardashian doing the blood facial or where she's covered in blood, you can imagine they've created these holes in her skin, but all of a sudden they're filled up with fresh blood. Well, that's not doing anything, because anything that I put on top of that, it's already filled in with blood, so there's nothing else that can go in. So you actually want your microneedling to be relatively bloodless, because then you have those ports available to absorb whatever we put on the skin afterwards. In Kristen's case, we're going to put some growth factor topically on her skin, as well as liquid sunshine for healing. You can do a little bit of Botox if you had an important event that you can put topically on. You can put Sculptra for a Sculptra glow and more collagen regeneration. You can put your crack pads, your lightening pads to really get in there. You can even put a retinol on top. There's some people in LA who will start with microneedling and then put an acid peel on top. That's pretty aggressive. I love it. I'm all for being cowboy, cowgirl with this stuff. But you can play a lot with this thing, but really think of this modality as creating channels to get some topical product in there. You can also do PRP, which is platelet-rich plasma, which is beautiful for regeneration if you have an important event. This is an awesome procedure. It's relatively no downtime, it's relatively painless, and it can give you amazing glow. I want you guys to see this tip, and I want you to see how these needles come out. They're just coming out a little bit, but that's exactly what's going in the skin, and as you see that red light, that's your radiofrequency energy coming out. These can go even deeper, so if you're talking about body toning and areas like a C-section scar or an old surgical scar that you want to get rid of or break down or tone up, this can go pretty deep, and those needles can come out this far if you're dealing with areas like the belly, the thighs, or other areas. But for the face, we don't need to go that deep, so you can see how deep it does go in. All right guys, so we finished the treatment here. You can see there's a little bit of redness. You can see it's bloodless, which is exactly what we want. Those little ports are waiting for me to put something on them. I'm gonna put TNS Advanced on today. I'm going to do this so she can get some rejuvenation of the skin. Remember, this is filled with over 350 growth factors, both botanicals, which help with antioxidants and rejuvenation, as well as peptides, which help with tone and texture. As I pump this out, I want you to do an even pump on both sides. You're gonna see two products come out, one that's clear and one that's a little bit more opaque. We want both of those coming out. It doesn't take much. Remember, we want you to use this every day directly on skin twice a day, and a half a pump should suffice. I'm gonna rub it together, and I'm just gonna lightly put this over her whole skin to give her that growth factors, those peptides, those botanicals directly in the skin. So we just gave her skin an exercise with the microneedling, and now we're giving her her protein shake. So just think about it, we're just rejuvenating her back up, and we're giving her skin what it really wants, which is food and growth factors and rejuvenation, and that's what we're giving back to her. We let that fully dry before we put anything else on top, but we're gonna top that off again with liquid sunshine for post-laser rejuvenation. So remember, our liquid sunshine is what we use for post-healing, post-procedure. When you're doing this at home, you just put it on your skin. I just stand there for a little bit, let it fully dry. You can feel when it's fully dry, and then on top of it, I put my moisturizer and my sunscreen, and no problem at all. It really does increase tone. It's the only topical product that has been proven to show results as early as 2 weeks and increase tone and lift. You'll have a little bit of a glow to it, so that doesn't necessarily mean that she's still moisturized, but we're just gonna pat on a little bit of our healing CBD oil. So remember, this one has 1,000 milligrams of CBD in it for healing and to decrease redness, and is beautiful. I'm going to ask Kristen not to wear any makeup today, just wear sunscreen. We love our color science with a little bit of tint in it, and she'll be ready to go. You can see how low downtime this is. My next process with her would be to move down to the lower part of her neck to increase this tone a little bit. So on her next treatment, she'll see how she heals from this, and then we'll move on to other areas of the body. So remember, this is not the only approach that we have for tone, texture, elastin, collagen. It's just one of the very many modalities. So come in, take a look, try it, see if you like it, see how your body responds. Remember, we want you guys to look great so you can feel great, so you can do great things. Take care, guys. Bye-bye.